COVID vaccines have slashed infection rates in NHS staff by 50%. Professor Tim Spector, who led the research from King's College London, said the findings were fantastic news. It suggests the vaccines are helping prevent people catching the virus and therefore testing positive, which would also slow down spread of the jabs have already been proven in clinical trials to be highly effective at preventing someone from developing severe disease or dying. But if they can also prevent people transmitting the virus, it would help come out of lockdown sooner. The government's scientific advisor, Dr. Anna Goodman, a consultant in infectious diseases and an investigator on the Oxford vaccine trial, warned there are still some people with the virus after vaccination, as shown in this data. At a webinar setting out the findings, she said, "When you've had your vaccine, you can't just presume yourself to be 100%. You can't go and visit an elderly relative and presume you'll be absolutely fine. That's not how the vaccines work." Professor Spector added vaccinated people shouldn't change their behavior, such as wearing face masks, while infections are and he warned the effects of the jab's effects did not kick until about 12 days after the dose, which is when the drop in infections between healthcare workers who did and did not have the jab. Professor Spector said, "This brings up the other point that at no point after you have had a vaccine are you 100%, but particularly that first 2-week period, there's like zero protection. And many people might be much more relaxed and there's some evidence that they aren't as concerned about prevention of a vaccine, and might rush up to relatives and go on public transport." So that's a really important public health message for everybody, that actually the risks are really high just after you've had the vaccination, but then it starts to. It comes after scientists warned yesterday the risk of infection in Israel doubled in the first 8 days after vaccination, possibly because people become drop in cases. The data focused on the healthcare workers who have been vaccinated and report to the Zoe Covid Symptom Study using the mobile. There are 220,391 UK healthcare workers on the app, around 3/4 of which have logged a vaccine, and around 13,000 coronavirus swab test results. Christina Hu, head of product at the study, said the reduction of 50% remains consistent as the overall population's COVID case numbers decline, meaning that the cases did not go down just because the overall infection rate in the UK. Professor Spector said, "It is fantastic news really that we were seeing this without having to wait 3 months to get a result. People need to have 2 doses of the vaccines being administered, from Pfizer/BioNTech and AstraZeneca/Oxford. But evidence is increasingly suggesting even after the first dose, the immune response is strong, giving confidence in the government's strategy to delay the second dose by." Professor Spector said, "I think this is the first sign that in real life, outside trials, what the effect is of a single dose." The professor of genetic epidemiology said the researchers were very interested to see if that 50% drops even further over time, especially up to. Professor Spector said, "Because this would seem to be vindicating the approach of the government at the moment about the 12-week delay. If we can get at least 50% protection, very rapidly." The UK government has decided to leave a gap of 12 weeks between 2 doses, rather than 21 days, in a bid to get more people vaccinated with at least 1 dose. The approach was initially met with some hesitancy, with little data to support it from clinical trials, but ongoing studies to assess how effective vaccines are after a single dose and with a 12-week gap between doses. On Tuesday, data released by the University of Oxford researchers said their own research showed 1 dose was 76% effective at preventing severe disease and death for up to 3 months. After the second dose is given, efficacy goes up to 82.4%. But given after 6 weeks, the effectiveness dropped to 9%, suggesting a longer gap between doses is best. The university said it supports the policy of leaving a 12-week gap between the first and second dose adopted by the UK government. Similarly, data from Israel, studied by the University of East Anglia, UEA, showed a single shot of the Pfizer vaccine gives 90% COVID protection after 21 days, at which point researchers believe it is unlikely to majorly decline. The Oxford findings were also the first glimmer of hope that the vaccine cuts transmission by around 67%. Dr. Andrew Pollard, chief investigator of the Oxford vaccine trial and co-author of the paper, told BBC Radio 4 Today that the Oxford/AstraZeneca jab could have a huge impact on. However, scientists cautioned that there would still be risks of coronavirus infection and deaths for several months yet in those unvaccinated. Some restrictions could last until spring 2022 because of this, according to Paul Hunter, professor in medicine at WEA.